unusual year for families and school staff, and as a student entering my senior year, I can assure you that it's a time of uncertainty for students too. We're all wondering how this year is going to work, what are the best things to do, and how we will make it through. So as we discuss back to school today, as a student, I'd like to thank you in advance for everything that you are doing to make it a safe and healthy school year.
Thank you, Caitlin. That was an introduction and note from my own daughter who is living with allergy, asthma, and atopic dermatitis. And she was just welcoming you to today's webinar, Back to School, Considerations for Students with Asthma in the Era of COVID-19. I'd like to also welcome you all. As I said, my name is Tanya Winders, and I am the President and CEO of Allergy and Asthma Network. And today we'll be looking at our topic of back to school and considerations for students in the era of COVID-19. This webinar is first being aired on July 29th, 2020. And all of the information shared today is in line with current recommendations. The coronavirus outbreak remains a very fluid situation, and guidance that's provided today may change in the future. This webinar supports the mission of Allergy and Asthma Network, which is to end the needless death and suffering due to asthma, allergies, and related conditions through our 4 mission areas of outreach, education, advocacy, and research. Joining me today are Dr. Mary Cataletto and Dr. Purvi Parikh. Dr. Cataletto is a practicing pulmonologist in the Department of Pediatrics at the NYU Winthrop Hospital and a professor of clinical pediatrics at Stony Brook University School of Medicine in Stony Brook, New York. Dr. Cataletto is currently chair of the Pediatric Network of the American College of Chest Physicians and is the editor-in-chief of Pediatric Allergy, Immunology, and Pulmonology. Complementing her clinical practice, she has been active in interprofessional team training and the development of provider and patient education programs to improve asthma knowledge and skills and promote patient engagement and self-management. Her past service with the asthma community includes serving as the chair of the Asthma Coalition of Long Island, as well as a board member of the Association of Asthma Educators and the National Asthma Educator Certification Board. She has published in both scientific and lay press and has been an invited speaker both nationally and internationally on many asthma-related topics. Welcome, Dr. Cataletto. And second, I'd like to introduce Dr. Purvi Parikh. Dr. Parikh is an adult and pediatric allergist and immunologist at Allergy and Asthma Associates of Murray Hill. She is currently on faculty as clinical assistant professor in both departments of medicine and pediatrics at NYU School of Medicine. She has been passionate about health policy and is on the board of directors of the Advocacy Council of the American College of Allergy, Asthma, and Immunology. She frequently travels to Washington, D.C. to influence policy, testify before the government, and advocate on behalf of her patients with the organizations for which she volunteers, the United Nations Foundation, Shots for Life, and Allergy and Asthma Network. We look forward today to discussing back to school, especially in light of the new information from the CDC. So as you can see here, this is the plan for our time together this afternoon. We will go over some of the current statistics around COVID-19 globally as well as here in the US. And then we will look at key messages for COVID-19 prevention and control in the school setting. We'll then turn our focus to asthma care at school and again, the considerations specifically for asthma in the era of COVID-19. And then finalize our time together with resources to help schools and families. So as we've done at each one of the 8 previous webinars on COVID-19, we like to start with the Johns Hopkins COVID dashboard. To date, there are over 16 million confirmed cases of COVID throughout the world, with over 4 million of those specifically in the United States. Unfortunately, we have now exceeded 660,000 deaths due to COVID-19 across the globe, with almost 150,000 of those coming from the United States. I remember the day that Dr. Fauci said we could likely see 100,000 Americans die from the COVID-19 virus. And we thought that seemed like a very long way off, and certainly that seemed unattainable. But as we sit here in now the 5th month and in the 9th webinar of our series, I think you all will join with me in just recognizing the significance and the impact that this pandemic continues to have on our nation. The CDC numbers, again, we always like to share this as a resource with you on these webinars. And as you can see, as of today, the CDC is reporting 4.2 million total confirmed cases with 54,000 new cases and 147,672 deaths, with 1,126 new deaths in the past 24 hours. And again, this is a very helpful data set because it demonstrates where those concentrations are and where those epicenters may be throughout our nation, and also shows you the current status of each state. So both the Johns Hopkins site and the CDC site are very valuable in helping us to keep track of the numbers. So what are the headlines? What's in the news this week regarding coronavirus? Definitely the World Health Organization has affirmed that coronavirus easily is the most severe public health emergency that we have ever experienced. And countries that previously appeared to have the pandemic under control, unfortunately, are recording an uptick in cases. So it's not only here in the US that we're seeing that uptick in cases. There was a recent release of a study from the UK that actually showed 6 distinct types of the coronavirus disease. And so that's a very interesting development as we learn more about the disease and the various phenotypes that may exist. There are now more than 40 states that have some type of mask requirement. And so while that remained a question at the outset of the pandemic, should we wear masks or not wear masks? Now, universally, we're seeing that most states are moving those mask mandates forward. We also are excited to report that the first phase 3 trials of a COVID vaccine have started here in the United States. And both Moderna and Pfizer have reported those phase 3 trial startings in the past week. Some states are setting records for the number of cases, and we still see those epicenters of Florida, Texas, North Carolina, Tennessee, Ohio, Indiana, and Kentucky really outpacing other areas of the country. Dr. Fauci was quoted this week as saying, "We just can't afford yet another surge like that seen in the recent weeks in the coastal areas of Florida, Texas, Arizona, and California." And so again, we hear our public health officials imploring us to take the necessary steps. I heard the Surgeon General today make a very pointed point in the conversation around disparities in COVID. And he said it really does come down to 3 basic W's: washing our hands, watching our distance, and wearing masks. And I think that's a wonderful takeaway that we all can attest to. So again, we have seen here in the US that we hit that peak in our COVID cases, new cases by day, in mid to the latter part of July. And we fortunately have seen a decline over the last week or so in the daily case report. We always like to remind you that Allergy and Asthma Network does have a very updated COVID-19 information center. And here is the URL where you can find webinar recordings, patient programs, infographics, fact sheets, a whole host of resources, as well as some advocacy guidance state by state on the way that businesses and schools and other institutions are reopening. So at this point, I just want to remind you that this is a constantly evolving situation. We know that the guidance is likely to change and change and change again, as it has done so over the last 5 months. But we appreciate your willingness to stay with us and to stay engaged as we continue to look at these various issues surrounding the coronavirus and the current pandemic. And now I'm going to turn it over to Dr. Purvi Parikh, who is going to give us the key messages for COVID-19 prevention and control in schools.
Thank you very much for that. So yes, that's very true. Things are changing week by week and even day by day. So basic principles as we consider reopening schools and moving back towards educating our children, college students. So sick students, teachers, and staff should absolutely not come to school. You know, this is one key and easy measure to help curb the spread. Enforce regular hand washing with soap and water or hand sanitizer. Daily disinfection and cleaning of schools, and social distancing. So this may mean limiting larger gatherings, changing the way recesses, phys ed, lunch is handled, and even the classroom structure. Next slide. So again, social distancing is key in curbing the spread. Staggering maybe the beginning and end of the school day, canceling assemblies, sport games, other events that create crowded conditions, and when possible, create space for children's desks to be at least 6 feet apart. I would argue even more so than that. And then teach and model creating space and avoiding unnecessary touching, especially in the younger children who may not be used to social distancing measures. Next slide. And this is key, like developing policies for going forward. So every school, even before they consider reopening or have their opening day, should have very strict and thorough policies in place. So isolating students and staff that become sick while they're at school, an easy way for information sharing among students, teachers, parents, and caregivers. Attendance should be flexible, as well as sick leave, given what is going on, because we want to accommodate students for the greater good. Ensure continuity of education, and then coordinate with local public health officials when needed. Next slide. So be prepared to deal with COVID-19. So, you know, not every fever will be COVID-19, not every virus will be COVID-19. Again, school-age children are prone to viruses, period. You know, so we see during back to school season, flu cases uptick, the common cold uptick, other respiratory viruses, as well as allergies and asthma, to be honest, with many of the same symptoms. So nursing assessment will be extremely valuable during the back to school period. Asthma care will be vital, the action plan, and then calm guidelines-based care. So everybody should have a plan in action. And, you know, this is a great infographic that has been made by the Allergy and Asthma Network that helps distinguish between viruses versus allergies versus other etiologies. September asthma peak is not new for this crowd. We know that every year fall is a problem. Third week in September is asthma peak week, as we all know. So it's a perfect storm of triggers. The weather is changing, there's ragweed in the air, viruses in the air, and now we're in the midst of a pandemic. So these 10 steps to follow are very, very helpful in preventing you or your child from becoming one of these statistics of the 25% of the hospitalizations, the 10.5 million days missed from work or school, you know, and the 14.2 million days missed due to asthma. And what is key, in the key takeaway is that if you're under control and you're proactive about starting your medications and those controlling factors early, you're less likely to get sick, you're less likely to flare up and end up in the hospital or in the doctor's office. Parents, now this is key. Make sure that you stay up to date with the latest facts. Recognize the symptoms of COVID-19. Keep children in school when healthy. You know, it's good for their learning, for their development. Reinforce the need for hand washing. And, you know, deal with your own stress and help your child cope with their stress too. You know, this is a very unique time for all of us, and the mental health toll is not small at all. So all of these things will be very helpful. And then make sure you're armed. So the flu shot, you know, get it early, because last thing we need is a flu outbreak in the midst of a pandemic. Make sure you work with your physician to have those asthma action plans ready to, and all of your emergency and controller medicines stocked up and ahead of time. Next slide. And with that, I'll hand it over to Dr. Mary Cataletto, and she'll go further into detail for back to school considerations for students with asthma.
Thank you very much. This section is going to be a little bit more pediatric. So while you may hear some of the same major headings, I'm hoping to delve a little bit more into pediatric care. So the SARS-CoV-2 virus is basically one that starts and binds into the cells in the nose, starts to replicate, and passes and goes all the way down into the small airways. Next slide. And it's a respiratory virus, so you can get it by close contact, and it can be airborne, as you may see using a nebulizer, but mostly it's going to be close contact, and that's why we talk about social distancing, why we're going to talk about masks, because that is the primary way that this infection is spread. In addition, if you should cough on a hard surface or somebody should sneeze or be talking, these can be transmitted to fomites or hard surfaces where they can remain contagious for a number of hours. Next slide. Now, the question always comes up whether asthma is a risk factor for COVID-19. And you're going to see a number of different opinions. And the answer, truthfully, is maybe, because the evidence is mixed. But based on the information we know about asthma and viral infections, we know that asthmatics are at increased risk for more severe outcomes. We know that these severe outcomes or exacerbations are more likely to occur in people who have poor symptom control. So that's important. We know that many asthmatics have problems with their immune systems. And we know that patients in both pediatrics and adults are at increased risk for developing pneumonia and hospitalizations as complications of these exacerbations associated with viral infections. There are two sets of data that are available at this point. The pediatric data is limited at this point, but we know when they first looked at hospitalized adults, almost 90% had an underlying medical condition, the most common being obesity and hypertension, and the third being chronic lung disease. In the younger age group of 18 to 49, they subdivided the chronic lung disease out a little further and found that asthma was a primary diagnosis within that subgroup. Next slide. So every parent, every family has to weigh whether or not their children will be going back to school. And they're going to look at the benefits of in-person learning. And the American Academy strongly advocates, for the reasons that we have listed here, that children go back to school face-to-face in the fall, because the instruction is more effective. No, go back. The instruction is more effective. Social and emotional skills are better dealt with. It's a safe environment, and the nutritional and physical activity needs are addressed. But you worry about transmission. Next slide. So each of us want to know, what is my school doing to protect my child? We know that we have almost 57 million children in our public and private schools, 8.3 or 4.7 million children in the United States have asthma. So this is a big group that we need to take care of. Next slide. Now, this is a common point of discussion among pediatricians, particularly pediatric pulmonologists. In the 3 months that our kids were home, many of us saw improved asthma control. The children weren't outdoors as much, so they had less exposure to allergens, less exposure to air pollution, and they were not with their friends and other children, so they had less upper respiratory tract infections. And social distancing policies were in effect outside of school. So actually, initially, we saw some good asthma control, and some of the kids that are coming back to the office are basically saying, I did very well these last couple of months, so I stopped some of my controller meds. Next slide. But don't miss the elephant in the room. There are a number of papers out that talk about chronic and toxic stress and its effect on asthmatic patients. So during the pandemic, a number of families lost their jobs, and as a consequence, lost insurance, lost support services for their children. And we know that there were increased numbers for domestic violence, child abuse, community violence. We all are very familiar with all the protests that went on. And we know that asthmatic children who have poor control have a little more problem with anxiety and depression. And we know that we're seeing that in the general group of children. We have to pay attention to that. Next slide. So the big question we have is, will the student who left school before the quarantine be the same one who comes back to you? And I'm sure you all know the answer to that question, so don't expect a one-size-fits-all solution. Next slide. So these are the asthma goals for school health from the CDC. I'm sure most of you are familiar with that, but there are going to be some major differences. The infrastructure and the supportive policies are going to be a little more flexible. We know that we are in a dynamic situation. Things are changing and we may have to change along with them. After the last slide, you know that mental health services as well as physical services are going to be very important. Some students may not have had the medical care that they needed, the immunizations that they should have had, nor had any mental health issues that came up during the pandemic addressed. We're going to need to count on our families. It's very difficult for families to work when their children aren't at school. So we need to be able to basically present the information about how important it is to have children stay home when they're sick. And lastly, physical education and activity is extremely important and one of the goals for school health. The last one, and you're going to hear a lot more of it next time, is about asthma education. No, we're good. Because the answer is to educate, educate, and educate. And most of that is done by the school nurse. Now, because we talked about, and we will continue to talk about the fact that we are going to try and enforce or promote social distancing, it means that there may be multiple teaching sites. We may have extended times, and this will certainly stress and stretch our workforce. So the nurses are going to be responsible for educating not only students, but teachers and coaches. They need to know which students are at risk for an asthma emergency, be able to recognize symptoms, understand what triggers are, and the kids are going to need to know their triggers as well. Their medication needs to be immediately available. If we're using other sites, it may be too far and too long for a child to go, particularly by themselves, from that teaching site to where the school health office is located. So very important that their medication should be available to them if they have a problem. And there should always be an emergency plan for severe asthma episodes. Next slide. Now, Dr. Parikh talked to you about the millions of school absences that are associated with poor asthma control. We know that this impacts every student that it occurs to, because sometimes they're so sleep deprived that they don't pay attention in school. Sometimes they can't even get up to go to school, and they may have multiple absences because of their asthma flares, the need to see their doctors or go to the emergency room, or even coming to the nurse. Next slide. So we focus very strongly on training and guided asthma self-management. This can be done in one of two ways: patient-directed self-management, which you are more likely to see in the older children, where patients make changes in accordance with a written asthma action plan, and the doctor-directed, which you'll see more commonly in the younger children. And in those cases, you still see a written asthma action plan, but they do consult with their doctors in terms of making decisions. Next slide. So the essential components are the fact that they have some guidance. And I'm sure you've all seen this asthma action plan. I chose the one from New York, which is shown here on this slide, but it basically gives you a plan on what to do to recognize and respond to worsening asthma. And this asthma action plan should be written. It should be available for every student. This is from the GINA 2020 guidelines. And the New York Asthma Action Plan has the top copy in English, the middle copy in whatever language the patient speaks, and there are a number available. And the third one, which will go into the school forms, will be in English as well. Next slide. So I'm going to summarize this fairly quickly in terms of training. We know that we have to educate and educate and educate. We need to provide students with asthma, their families and caregivers with the information they need so that they can participate in their care. So for the younger children, that means training them and teaching them at the level they understand, and for training their parents so that they can understand and learn along with their children. Remember that health literacy is an important piece of this. Health literacy is not reading literacy, and only 12% of American adults have adequate health literacy, which is kind of a frightening number. So we have to pay attention to this, develop shared goals, and patients need to be very comfortable in understanding their medications and following their asthma action plan. The last piece on here, and this is a quick comment, understand that during the COVID pandemic, we often talk about the quarantine 15. Children don't quite have the 15 in all cases, although some of them I've seen do. Remember that weight gain associated with comfort food and being home and being less active is a problem that is associated with increased asthma. Next slide. This is the asthma-friendly schools characteristics. I put it up here only to show you that it's very similar to the new guidance. Next slide. And most importantly, understand that these school-based studies for education and self-management for children in the school age group is associated with significant improvement, a 30% decrease in ED visits, and a significant decrease in hospitalizations and days of reduced activity. So these are very important, and it will be even more important to get them up and running when school changes. Okay, back to school. We're talking about less crowding, more social distancing, with the same number of faculty. And you can see some of the pictures here. Some schools are going off-site. Some are working virtually, some are picking hybrid. We need to pay attention to those venues and take advantage of all the opportunities that we have in addition to the standard education, but to resume health education. Next slide. Okay, social distancing basically means physical distancing. And we do this to lower the risk of the SARS-CoV-2 spread. So for adults, we all know that we should distance 6 feet apart. In addition to doing that, adult-adult physical distancing in both time and place is important. And what does this mean? This means we may stagger drop-offs and pickups for kids coming to school. This means that we may prohibit adults who are not involved in the day-to-day activities of the school to try and limit coming into the school building itself. And then there are recommendations for children that depend not only on their age, but their ability to understand and to be able to take a mask on and off and to follow the rules about social distancing. So let's talk first about kindergarten, preschool. It is unlikely that left to their own accord that they're going to social distance. That's not what little kids do. So what are the recommendations? I would recommend that all of you take a look at the AAP guidelines, which have come out and they've continually been updated just like the CDC ones. I think they're a little more realistic in terms of the pediatric age group, and what they recommend for the preschool children, the kindergarten children, is that you pay a lot of attention to all of the other mitigation measures, the hand washing, the covering your cough, covering your mask, those types of recommendations, whereas they become more stringent as you get older and are able to wear the mask throughout the day, and it's recommended for middle and high school. And certainly those people can have their desks put 3 to 6 feet apart, which is the AAP recommendation. The recommendation for CDC is still 6 feet. The other thing that you'll see in all of the pediatric recommendations is the use of cohorting, where teachers will move from space to space, but the children will be and wear a mask and the children will stay the same. The use of outdoor activities. So for areas and activities where there are more likely to be issues with transmission, for example, singing or gym or things like that, if you can do them outside, that is a great way to go and will help to limit transmission because you can keep the kids further apart. And that's a place where you might be able to have better luck with physical distancing. Next slide. So here are some options for the school experience: alternating schedules, half days, cohorts, and there's a number of choices here that the school administrators can take a look at. The reference is there for you, but there are special considerations that you need to think about, not the least of which is additional teachers and additional nurses. So we recommend that you get input from all your stakeholders, and the school nurses are going to be particularly critical in this regard, especially for children with chronic illnesses such as asthma. Next slide. So these are some risk stratifications for social distancing. They're placed into low, medium, and high risk. So you are at the least risk if you're not there in school, if you're only studying virtually. The highest risk is if you're in the classes the way we've previously known it. And we know that both of those are going to be difficult choices. So we are working very hard to take that middle group and work very hard on mitigation strategies. Next slide. Now, we talked about some of the strategies that will need additional workforce. And this is a slide from Kaiser. And when they surveyed teachers, they found that 1.5 million were at risk for serious illness if they got COVID. So these were basically teachers who were either over 65 or had a comorbid condition. Next slide. And what about nurses? 1 in 4 schools doesn't employ a school nurse at all, and these are national numbers. We believe that the school nurse plays an essential role in helping to develop policy as well as implementing care for children, and certainly for educating staff and children with asthma. Next slide. So here is a infographic that you can look at from the Asthma and Allergy Network. The key issues in educating your staff, and I would say everyone who interacts with your children, to be able to identify an asthma episode, understand when to give medication, know where the medication is, and we've talked about this before, and you should always have an emergency plan. Next slide. Now more than ever, it's very important for our children not to come into us and say, I'm taking the yellow inhaler. You can see from the picture on your left-hand side that many times more than one color appears in the same category, and you don't want to mix up your controllers and your relievers. So you need to know which medication is right, what the right dose is, when you should take it, and how you should take it. And that means that you need to be very comfortable with your asthma action plan. And you can see here that this is something that the older child can certainly take and follow, but something that the younger ones will need help with, which means that those people who supervise them need to be very comfortable. Next slide. And we'll finish up here. Remember that the albuterol, which is your quick relief medication, either levalbuterol or albuterol, can be given in the nebulizer or by a metered dose inhaler. Because of concerns about aerosolizing viral droplets, Gina recommends avoiding nebulizers during the pandemic. Next slide. Okay, let's go through health hygiene. Many of these you're very comfortable with. Let's go to the next slide and we'll do them one at a time. Okay, soap versus hand sanitizer. The preferred method is to wash your hands with soap and clean water. And your alternative is the hand sanitizer. I would bring caution to you about the hand sanitizers because they have to be at least 60% alcohol. So you need to keep this out of reach of children, particularly young children, and any child who's under 5 that's using a hand sanitizer should be supervised with by an adult. Because with this alcohol content, even small quantities can be a problem. Respiratory etiquette is something that we talked about a lot during flu season, so I'm sure that's comfortable and well known to you. Cover your mouth and nose with a tissue when you cough or sneeze. Cough into your elbow. Don't spit, and those are old tuberculosis recommendations, but certainly are relevant here. And make sure at the very end that you throw your tissues into the trash and wash your hands. Next slide. Face masks are an interesting piece that is very important and of much concern to those parents of asthmatic children. They are recommended for kids 2 and above. You have to be alert and breathe normally and be able to remove the mask on your own. So if you are a severe asthmatic, we'll talk about some special concerns that you may have and some recommendations. So you want a fabric mask. We are not recommending N95s for the average person. The public is recommended to use cloth masks. And we do it to protect others in case you are infected with COVID but don't have symptoms. So you would wear it when you're around other people who don't live in your house, especially when it's tough to stay away 6 feet apart. You'll see wash your hands throughout all of these presentations. You wash your hands before you put the mask on. You wash your hands when you take them off. You make sure that it covers your face, like in the slide up on the top right. Remember that these are not chin guards. They're not headbands. It's important to cover your face so that respiratory secretions are not put into the air. Next slide. And most people don't know how to take them off. How many times have you driven down the street and seen them hooked on to the rearview mirror? How many times have you seen kids take them and shove them in their pocket? So remember that you need to take them off and have the outside folded in. You can put it in a Tupperware, you can put it in a sandwich bag, but make sure that they stay clean. Next slide. Remember that pandemics are very stressful. I'm not going to spend a lot of time on this part. I put this in here for reference for you, but remember that many households are seeing an increased use of tobacco, alcohol, and other substances. Keep that in mind. Many of the things as you start to look through this list are known asthma triggers, and certainly we talked about chronic and toxic stress. Next slide. Remember that children learn from their parents, they learn what they see, they learn from their teachers. Schools and homes are where they learn most of what they do because it happens in the early years from people who are role models. Next slide. So here are some things that you should be looking for. We hope that you are addressing these things in health class. Try and flag children that are having problems with excessive worry or sadness. Next slide. And here are some strategies to support your student. As I said, these are here for your reference. You can go through them at your leisure. I want to make sure I leave time for questions. Next slide. And this is our last slide. Remember that the key messages for this talk are, in terms of your asthma, you need to identify the children with asthma who are at high risk and in need of education. They need to have an asthma action plan. And within that, they need to know their asthma, they need to know their triggers. Medication needs to be available. And the common irritants and triggers need to be avoided. Healthy behaviors such as the annual flu immunization and all of the precautions that we have talked about here today to practice social distancing and respiratory etiquette, frequent hand washing and a face mask, and attention to stay home if you're sick and avoid sick contents are the key messages for this program. Okay, I'll turn this back over to Tanya.
Great. Thank you so much, Dr. Cataletto. Briefly, I want to remind you of some resources to actually help schools and families during this time as we get ready for back to school, and then we're going to turn it over for our Q&A time. So remember allergyandasthmanetwork.org. We do have your COVID-19 Information Center with COVID-19 in schools and schools, allergies, and asthma. There is also a number of downloads to help you distinguish between symptoms of COVID-19, allergies, asthma, the flu. So please use that resource as readily and openly as you would like. We do frequently update it to make sure that it is active. We also have a number of posters that are very helpful on respiratory treatments and respiratory tools. Again, if you want these for your school nurse office, please just reach out to us. We'll be happy to get them out to you. Or for your clinic, we've got a number of these resources and certainly want them to be readily used to help students as well as patients just identify the treatments that they're on and the tools that they are consistently using. Again, we have the number of infographics that have been referenced in this presentation as well as in our previous work, asthma and COVID-19, asthma care at school. Those flow charts and tools are there that could easily be downloaded and posted in your offices. The September asthma peak is also downloadable there, as well as our asthma take action, take control posters. We do have a number of different understanding asthma guides and children's books. And again, we will send these to you for shipping and handling only. So if you just give our office a call or drop us an email after the webinar today, we'll be happy to get those sent out to you as well. And we do have specific tools that are targeted at different ages as well as children of color to make sure that they can relate to someone like them. And our Asthma 101 guide, Understanding Asthma, is written at a 6th grade health literacy and reading level. We have our Asthma Storylines app, which allows you to track your symptoms as well as your moods and your medication use. And we have our Patient Learning Pathways, which is an online video training program, very short, different topics that help parents as well as patients to just skill up their learning and understanding of the disease and how to manage it more effectively. So at this time, we're going to go to some of the questions that you all have posed. And I'll start out actually with the first question going to Dr. Parikh. And Dr. Parikh, this question comes from Laura, who asked about nebulizer treatments. Is it still not recommended for asthma care in schools in order to minimize the exposure of aerosols? And can we, as a school nurse, actually refuse to nebulize and only accept rescue inhaler orders?
Yes, so, we still are discouraging using nebulizers frequently. And again, I just want to stress one fact, if a child's asthma is out of control, to the point where they need a nebulizer, because a nebulizer is meant to be, a rescue treatment or a quick relief treatment. If the child is that uncontrolled, they shouldn't be in school, period, and the guidelines from staying home from school are going to have to be very strictly enforced, so hopefully it's not a situation where you need to use a nebulizer often, because if the child's asthma is out of control, they should be staying home anyway. But that being said, yes, I think rescue inhalers, the MDIs, are safer to use first and foremost. In terms of refusing, there could be situations, where the child absolutely needs it, and if they don't respond to the MDI, and nebulizer treatment is okay, on a case-by-case basis. But then it is important that, the school nurse is stocked with appropriate personal protective equipment. So that includes mask and the gown and shields and whatnot, just to minimize risk and exposure. But again, I can't stress enough that, children with uncontrolled asthma should not be going to school during the pandemic for their own health and those around them.
And we have a number of questions around nebulizer use in the question box. We won't get to all of those, but I would highly recommend, if you have those questions, our last webinar, the number 8 in the series that is available at our website, does go into great detail around the steps that a school nurse would likely need to take to protect his or herself, as well as the student and the office from transmitting COVID due to the aerosolization. So definitely that's a great resource to reference as well. Thank you, Dr. Parikh. Our next question, Dr. Cataletto, a teacher asked me about the safety of masks that have a vented hole in them. Are these safe in the community and in schools, and what is the purpose of the hole?
Well, first of all, we know that the universal masking guideline is to reduce transmission of COVID. So the valve mask really doesn't add anything for you. A valve mask is a type of N95 mask that allows exhaled air to be passed through that filter. So it kind of defeats the purpose, because they'll breathe in the air, and if they are infected, they'll breathe out the infected air, the virus contaminated air. So remember that the masks that the public is wearing are basically to protect other people, but not necessarily to protect you. So very important that the N95 masks are used in hospitals with frontline workers because they have a different purpose. And we would like those masks to be reserved for critical personnel. So for the general public, the recommendation from CDC is that we use cloth masks for the general population.
Okay, thank you. Dr. Parikh, how do you suggest that we handle requests from parents that their child not wear a face mask due to a disability or because they have asthma and can't breathe well while wearing a mask?
Right. So, this topic will be coming up frequently, but, there's no data that, asthma, people who have asthma or other chronic lung conditions can't wear a mask, and that it's dangerous for their breathing or anything else. In fact, those high-risk groups with lung conditions need the mask more than others. So, that includes asthma, COPD, cystic fibrosis, and numerous other lung diseases. So there's no evidence there. There might be very, very unique situations, such as facial deformities or irritations or structural reasons that someone cannot wear a mask. But for the majority of people, they can wear a mask, and it's actually very, very safe. And those unique situations, will have to be evaluated case by case, by a board certified physician. Because again, there's a lot of misinformation out there about how masks affect breathing, and healthcare workers wear them 12 to 15 hours a day, and with no issue. And many of those healthcare workers have chronic lung conditions. So I would be very hard pressed to find an exception.
Thank you, Dr. Parikh. Now, we did discuss in our last webinar about the importance of a pulse ox in monitoring COVID specifically, but here's an interesting question from Misty, Dr. Cataletto, and she says, where can we find a protocol? Whoops, so sorry. Where can we find a protocol for pulse ox parameters to use in schools?
That's an interesting question.
I'm not aware of one
I don't
personally,
think
but
there
are
is
there
one.
is there any guidance for at what number on the pulse ox you would advise a school nurse to, seek emergency care for a student?
I would not make my decision in a school setting based on a pulse ox number. I would tend to look more at the child, see how hard they were working to breathe, look at their color. I would use much more clinical numbers. Remember that an oximeter measures the difference between the light frequency of oxygenated and deoxygenated hemoglobin, and it's very affected by ambient light, by motion. You really have to be very comfortable using it because the interpretation of a pulse ox number is dependent on the machine itself and the person who's making the interpretation. But if you need a number, an O2 sat of 90 is equivalent to a PO2 of 60. And that's where you get into the sharp portion of the curve, and that's not where you want to be.
May I interject for a moment?
Yes, please, Dr. Preek.
Yeah, I agree completely. You know, you can't just go by a number. You have to look at the whole clinical picture. Generally, what we constitute for admission to the hospital, if someone's in the ER or even in our office, is actually 93 or less. By the time you're at 90%, it's too low. One thing I think that would be helpful is that this parameter should be on the asthma action plan. And you know, that child's individual physician should give those parameters if you are going to be using the pulse ox as a tool. The issue with COVID-19 is we do see a lot of silent hypoxia with it, so it can be an important tool. But I agree, you know, with Dr. Mary, it's within you have to look at the whole picture, you know, and you know, I would caution against relying simply on a number. But generally for admission, anyone below 93%, we admit to the hospital automatically, whether they're working hard to breathe or not, because that is a kind of concerning number. 95 or higher, I would feel more comfortable not admitting them to a hospital. So, but again, the whole picture is important, and we might be moving to a new normal where this parameter is included on documentation from the child's physician.
That's very helpful, Dr. Preek. Thank you. And there is an article that was recently published by the National Association of School Nurse Magazine, whereby a Texas school district has published theirs, and it is online, and that's Plano, Texas. That was published in 2012. Actually, I just got a note around that. So the next question is an interesting one. School reopenings have acknowledged that the avoidance of wind instruments and singing is important due to the creation of the aerosols, but also nebs, and we've already talked about the nebulizers. What would be your guidance or recommendation for teachers or for the participation of classes like chorus and band? Dr. Preek?
Oh, sorry. Yeah, so currently, you know, I think it's going to really depend on if those classes will be taking place because of two factors. One, the social distancing issue, and the fact that if you're singing and expelling more air, you're considered a super spreader. Same thing with instruments, right? Because you're breathing in as well as exhaling harder to breathe. So that being said, some school activities may not resume immediately if appropriate social distancing can't take place. And again, the ventilation is extremely important because we are now getting information that COVID-19 might be airborne. But that being said, again, you know, we should be relying first more on the MDI over any nebulizer use. And again, if somebody is so sick, you know, they shouldn't be attending band practice or chorus practice if their asthma is not adequately or well controlled because of, you know, all the aforementioned reasons. So, you know, some of these activities we're really going to have to see if it's safe to even resume, to be honest. And this is something where I see there being a problem with a lot of spreading because you tend to be more of a super spreader when you're performing, either singing or playing a wind instrument.
Great, thank you. We'll have one more question for Dr. Cataletta. If a student is sent home for
I add
viral...
one other comment to Dr. Parik's. The American Academy of Pediatrics has guidelines about sports, and it has guidelines about, choir and chorus and all the rest of that. And the recommendation for that is that if you have the opportunity to do it outdoors, where you can have some distance between the kids, that's something that you can consider. So in addition to the CDC guidelines, I would certainly point everyone to the American Academy of Pediatric websites on back to school.
Yeah, that's a great point. Thank you for reminding us that they do have that guidance as well. So another question for you, Dr. Cataletta. If a student is sent home for viral symptoms, what do you believe will be required for them to return to school? Just simply a physician's note, a negative COVID-19 test? How do you anticipate that we will allow students to return?
Children will get, the question is, what do they have? And I think that the first question is, what do you do when a kid comes to school and they develop a fever there, if they get sick while they're during the school day? And that's going to be an issue in terms of febrile children are going to need to be isolated. The school nurse is going to have the appropriate PPE. If you have to give a treatment, it's going to have to be in an isolated room where they're not as near anyone. And we know that from school nurse surveys that there aren't a lot of those isolation rooms in school. But as far as coming back, it's going to be a very individual decision. And that's why when we talked through those slides, we also talked about the need for school policies and working closely with the pediatricians. I think that if somebody goes home from school and they have a fever, that they will need to be in contact with their pediatrician, and the school will need to communicate with the families, potentially with the doctors, with the family's permission, to see if they felt the children were needed to be tested for COVID-19, or if they were examined or seen virtually and decisions were made. Thank you.
And if students and staff become sick at school, should that classroom be notified? Or how many cases do you believe would lead to a school closing? Like what percentage of the students? Dr. Preet, do you have any thoughts around those two things? Oops, Dr. Preet?
Oh, sorry, I was muted. The second part of the question I had missed, if you don't mind repeating it.
So if a student or staff member becomes sick, how should they go about notifying other students? And then how many cases do you believe would lead to a school closure? Is it a certain percentage of the school population?
Right. So that's an excellent question, and contact tracing is going to play a big role in schools. So ideally, as soon as somebody is identified as sick, they need to be isolated immediately, and then all close contacts. So anyone that teacher has come in contact with over the last even 10 days are going to have to be contacted, possibly tested before they can return back to school. And it may even go further than that, depending on who those people have come in contact with. So that's it's quite a large project, and there should be a good system in place before even the school starts. So even the people that the teacher has come in contact with, all of their contacts will also have to follow the same routine. Now, what percentage, that's hard to say. Isolated cases, if they can be isolated quickly and those people can be tested to return back to school, or those people can be isolated if they're symptomatic, then we should be able to get it under control. But then if multiple people start being affected, school closures may have to be considered. You may have heard it in Missouri. There was an outbreak at a summer camp where almost 80 to 100 children were affected just from one camp counselor. So we have to be ready for that fact that, it could spread quickly, and we may have to come up with a contingency plan if that occurs. The camp had to shut down ultimately.
Right. Well, thank you for that. Absolutely. I think that this is still evolving, and we certainly hope to have even more information and more guidance in the next month as we prepare for the back to school time and as students resume learning, whether that be virtual or in person. Tamara asked a great question about the 3 W's. I'll say again, wash your hands, watch your distance, wear your mask. We will create a poster that will be available for download from the network. So we'll work on getting that ready and out to you all very quickly. Several people have asked if you could post those in the hallways or around your schools. So we will take that as an action item from the network today. I want to thank you all for listening today. We hope that the information will help you as the first day of school is quickly approaching. Our next COVID-19 webinar is actually going to be on August 12th at 4 p.m. Eastern, and we'll be joined by CEO Captain Bill Kirk of Weather Trends 360, where he will discuss the weather impact on COVID-19, asthma, COPD, the flu, and more. And we'll actually be able to predict exactly when the peaks of each of those will come in the next year. And then thank you once again for being with us today. The Allergy and Asthma Network team works every day to help us all live the healthiest life that we possibly can. I'm Tanya Winders, and on behalf of the staff at Allergy and Asthma Network, we wish you a healthy day as we work to breathe better together. Thank you for your participation and have a wonderful day.